When treating all types of pain with the sanakey, we need to know what we're actually treating as in the symptoms. So what's a tension headache? It's generally a diffuse, mild to moderate pain in your head that's often described as a feeling like a tight band around your head. And it is the most common type of headache, but its causes aren't really well understood. So then what are the symptoms? Most of you will know that the symptoms of a tension headache are dull aching pain, a sensational tightness of pressure across your head like a band around the head, and tenderness in your scalp, neck and shoulder muscles. And all these symptoms we're going to be able to address with the sanakey. It's also good to look at the causes of tension headache. So perhaps we can make some lifestyle changes or actually treat the cause with the sanakey. So first of all, heightened sensitivity to pain is a cause of tension headaches. Heightened sensitivity to stress, and it's noted in most studies that the most common trigger is stress. Now we can address those things with the sanakey, and I'm going to show you how to do them in this little presentation. First of all, let's look at all the sanakey settings, the settings that you have in your device, and there are 5, and in most cases I would like you to use them all at different times when you are treating different things. Remember, the main thing is to do. If you don't get the result you want, you need to change the settings. So let's have a look at them. 5 different settings: basic, sedation, activation, harmonization, and relaxation. I am actually in another video going to go through all of these settings in minute detail to show you how to use them for the best results. But let's have a look at how we're going to use them in this case. Now, when we decide which setting to use, we have a look at how intense the pain is, and B, how long have we had the pain for. So let's have a look at the time period of the pain. If the pain onset is in the last 3 days or so, or the pain is intense acute pain, here's the 2 settings you can use: sedation and relaxation. So I always start with sedation if I have an acute onset of pain. If that doesn't work, I'll switch to relaxation. And in all these examples, I'm going to give you 2 settings to use. If either of those don't work, you just switch to another one. So you're never limited in which setting to use. Let's have a look at the next one: pain onset with 3 to 14 days. So you've had the headache for 2 weeks. Unfortunately, I hope this isn't the case for some of you. First of all, you would start with basic, and then you could alternate that with relaxation. Chronic headaches, we're looking at using activation and harmonization. And headaches that don't respond to treatment, if they are simple headaches, obviously if in doubt, go and see your health professional. But relaxation and harmonization for those headaches that don't respond to the treatments that we've put out there before. So have a look at those. If these don't work, just change to another setting. All right, so sanakey treatment. The 3 main steps that we use: scan for key points, treat those key points, and assess the treatment. So now let's go back and to have a look at scanning for key points, looking for key points. What are the key points? What are we looking for? They're actually the doorway to the body's pain relief, where generally you'll find the sanakey electrode sticks to the skin, like it drags like a magnet. When you come across an area that needs treatment, the impulse coming from the sanakey will feel stronger without you increasing the energy. And also the sound of the sanakey as you drag across an area gets quieter, and when you are dragging, the color of the skin in the area being treated has a pronounced change. So it could get very red, and that's a very common way. The stickiness and especially the color will be an indication of where to treat. Finally, when you treat the actual area, you can hold the device as you're going to do in this treatment treating headaches, or you can brush in 4 different directions. The main point to remember is you're holding the device firmly on the skin. If you're brushing in 4 different directions, and the direction that is the most resistant, the hardest to move, is the one you keep doing, because that's the one the body's telling you you need to treat. And once that stickiness goes, you can then assess your treatment. And by assessing the treatment, I mean, are you happy with the treatment? Have you achieved the pain relief that you want? If not, then what you have to do is repeat the whole process again and change your setting, which we discussed in one of the previous slides. So now let's have a look at the protocol for tension headaches. You're going to see 3 photos here: step 1, step 2, step 3. Step 1 and 2, as you can see, very simple, on the temple. Step 3 is in case we don't get the change we want. So first of all, what you're going to do is adjust the energy to a gentle level. You can feel it should not hurt. The sanakey impulse should never hurt you. First of all, you're going to slowly scan the temple area of the head. Remember, you're looking for sticky spots. And you want to scan the area large enough to identify those key points, but don't worry if you can't find the key points, just simply hold the device directly on the temple. And what you're going to do there, you're going to leave the device stationary for 5 minutes. And that's why you need to have the energy level at a comfortable level. I say to my patients, and I'll always say that in these videos, go for comfortably uncomfortable, which means you can feel the device there. It's not hurting, but you know it's there. So once your 5 minutes is up, you're going to swap to the other side and you're going to repeat the same treatment on the opposite side. Don't forget, you may need to adjust the energy level of the device because it could be quite more sensitive on the other side. Now just remember, if your pain is more intense on one side, begin the treatment on the pain that has the lesser side. And if you have equal pain all around the head, just start on the left side of your head first, 5 minutes, then you're going to move to the right side of the head. So moving on, we're on the opposite side. Once again, scan the area large enough to identify key points. If you can't find the key points, simply hold the device directly on the temple. And once again, leave the device stationary for 5 minutes. Now, what should happen is your pain relief should be complete from that treatment, or enough that you can keep functioning. If not, let's assess. If the headache remains, you're going to select the basic mode, so that's going into the menu, settings menu, back to basic mode, place the device on the forehead, just as you see in this picture, and remain stationary for 2 to 4 minutes. Once again, you may need to adjust the impulse level again because the forehead is a fairly sensitive area. You should be, once you do 2 to 4 minutes on that, most of the time you will find your tension headache will be completely relieved. Now, if not, go back to the scan, treat, assess again. If it doesn't, change your settings and do the whole treatment again. Okay. So when we talked about the symptoms, we saw that you will generally have caused by a lot of stress. Now, when we have stress, we get very tight neck and shoulder muscles. So it's always good to do a neck zone treatment. Very simple to do on yourself. Set your energy level on the neck and drag the device down each side of the neck, looking for those sticky areas. And if you have a look in this video, you'll find that my willing patient, as she drags it across the neck there, it's getting quite red. No need to hurry. Take your time. You could do it for 5 minutes. You can do it for 10 minutes. Just do it enough to get the relief you want. And remember, if you can treat a couple of times a day, just leave an hour or 2 in between each treatment. So you treat the head and always treat that neck zone at the end of the treatment, because that'll stimulate the whole area, stimulate the blood flow and the relaxation of the body. So very good treatment to do. You can do this actual treatment in any setting you wish, just by simply switching the device on into basic, turning it up till you feel it. Very good treatment for reduction of stress. So good luck with that, and I hope you have success. Remember, try it, it works. It's something we use in the clinic all the time, and I'll see you next time.